Hi, I'm Candace Grant, your postural specialist. Have you ever stopped to wonder what is actually happening with your body when you are feeling pain and discomfort? Do you focus on the symptoms of what is happening, or do you kind of stop, take a deep breath, and look for what the cause of your discomfort is? Most people have a tendency to focus on the symptoms that they feel versus look for the bigger cause of what is going on. So let's talk about dysfunction and compensation for a minute. Dysfunction is the fact that your joint or your muscles are not able to move properly. This could be due to overuse, injury, inflammation, poor posture, genetic disorder, or maybe even an injection, something that has happened to cause that joint to not work properly. Now, compensation is something that is happening in your body as a result of this dysfunction that is happening somewhere in your body. So then it's your body's way of adapting to the misalignment of the musculoskeletal patterns and therefore causing bigger issues. So therefore, you end up getting a compensation pattern between your dysfunction and your compensation. So the dysfunction creates a compensation, which creates another dysfunction. And you may not feel this simultaneously, but you may end up feeling this over years. So therefore, the symptoms that you're feeling now could be due to related something that had happened years ago, and it has actually just taken a while for it to work up to the chain of events of what you're feeling now. For instance, if we look at a shoulder, and let's say your shoulder drops and therefore the hip drops, and now you have shoulder pain, it could have been that your shoulder created that dysfunction, then the dysfunction of the hip, and now the result of the pain. So, if we don't fix the actual cause of the injury, then all of a sudden your body will start to compensate in many patterns. So if we look back to, let's say, a broken or badly twisted ankle, what happens is you may have had a boot on, and then therefore now your knee is compensating, your hip is compensating, and that pattern's all the way up due to the fact that your foot was in a boot for a period of time. And now all of a sudden, because you're not able to walk, heel, ball of toe, and foot off, your body has been sent into a compensation of foot going out, knee going out, hip also laterally everting, and therefore over time, this hip may also feel higher because that boot difference, that'll drop the other hip and therefore now cause some shoulder pain years from now. So when we look at the causes versus the dysfunction, we need to focus on not just the symptoms, but the actual causes, because everybody may have similar symptoms, but that doesn't mean that that is the actual cause. So we need to understand that one, there is no quick fixes. Quick fixes come from, a quick adjustment or a great massage. It can come from a medication. It's usually in the form of passive therapy. Even physiotherapy can not necessarily be a long-term fix because they focus on the symptom itself of that shoulder not having the range of motion. How often have you gone to a physiotherapist and they have taken a picture of your whole body and related to that ankle injury is now the cause of that shoulder dysfunction going on in your life now? So we need to understand three things when we are looking at posture therapy. One, the source of your pain is not always the symptom of your pain. So just because you're having symptoms here, the original could have came from the opposite hip or the same ankle, and just over time created that compensation and lack of mobility and movement. Two, we need to understand and have a system to spot those hidden pain points, because what happens over time is that your body and your brain will both start to adapt. So your body starts to think This is normal. And then we go into excuses of age, injury, wear and tear. It's our parents, my parents had a bad shoulder, therefore I do. That is all incorrect. The reason age comes into a factor is because we may not be moving the same way that we were when we were 10, 20, 30, and now in our 50s or older, our bodies had gone into a compensation because we just haven't used the muscles and the joints the way that they're meant to. We no longer play soccer. We no longer climb trees. We no longer are, being on the ground and coming up. Even our adaptations of technology, we don't necessarily rake leaves, instead, we blow leaves. So our bodies are not moving the way that they used to years ago. So now all of a sudden, the age factor is because we're not moving our bodies the way that they're meant to. We just simply stay within our pain box and we don't move outside of that, never pushing ourselves. Now, that being said, we don't also go with the no pain, no gain, because when you're over pushing yourself, you're over pushing that compensation or that dysfunction rather than going into an alignment of everything that's going on with your body. So we need to start to get straight before we strengthen. We need to start getting the muscles to move in isolation and the way that they're meant to be rather than over pushing them. When we go to a gym and we are focused on strengthening, then we may be strengthening all of our dysfunctional muscles. We may be doing the wrong exercises or focused on the wrong muscle groups to perform the job. When you can't lift your arm over your head, other muscles will pitch in to get that shoulder to do the right job. So we need to stop with the excuses, and we need to start looking at where the pain is coming from versus where you're feeling it. Because there's a lot more going on in your body than what you think, right? And there's a lot of times that we go, oh, I didn't even know that hurt. There's a lot of people that don't think they have balance. And so they wear their shoes all the time, maybe in their house, because they don't have that mobility in their ankles or they don't have that balance in their feet. Therefore, when they start to do balance issues, their feet may hurt, but your feet are all about balance. And what is happening at your feet is going to keep moving up in compensation. So the last thing we need to look at is lasting relief is possible. When you address the right problem and the right sequence, then we will have lasting change. If you are addressing the wrong muscles in the wrong sequence, then what you're going to do is create more dysfunction and more compensation within your body. When you start strengthening the muscles and the larger movements, you are changing that pattern. And once again, you're back to that dysfunction compensation patterning. So therefore, longer lasting relief is possible, but remember, it takes a long time. How long did you have this issue? We need to back it out. So posture therapy is all about finding the right muscles to do the job, looking at the cause of the pain versus the symptom of the pain. How do we need to realign your body, because your body is different than your neighbor's body? Even though you may have the same symptoms, you don't necessarily have the same cause. Posture therapy is all about maintaining function in your body rather than quick fixes of, I need to fix this now, right? There's no temporary or quick fix when it comes to posture therapy. It's about teaching you to use your body the way it's designed for the next 20, 40, 60 years. It's about teaching you what to do when you get into trouble, because your body will always go through a little bit of dysfunction or compensation, because that's you know, that's what we do. We do things that we don't know that we can. We try to stay within this pain box. And when we come out of that pain box, all of a sudden we may stir up old injuries, or we may not realize that we don't have that motion. So it's teaching your body how to move better in function and getting everything, uh, getting new blood flow, getting new oxygen, realigning your body. So then that way, now you can go and strengthen that body and live a happier, longer life, because it's up to you whether you want to live the next 10 years in a wheelchair or riding a bike. So I'm Candace Grant. Thank you. And I hope that this has been a little bit more of an insight to what posture therapy is, as well as the dysfunction and compensation patterns. Have yourself a wonderful